Stacey Stewart, CEO of March of Dimes, joins us now. Stacey, so good to have you on. How should women be reconciling these two conflicting opinions?
Well, you're right. And thank you for having me this morning. It has been really confusing for women, and it really shouldn't be, especially pregnant women who are already dealing with so many decisions with respect to a newborn baby. You know, the WHO's guidance was very confusing, really recommending, as you said, against pregnant women receiving the vaccine. It seemed to be very different from what the CDC, which is really our guiding authority here in the US, although the WHO is very well respected for us here, it would seem to be very different. And part of the problem that we have is that pregnant women were not included in the clinical trials. And that is really considered the gold standard when it comes to whether or not a vaccine is ultimately safe and effective for anyone. And the fact that pregnant women were not involved is really a long-standing practice, really an outdated, outmoded practice that we at the March of Dimes have advocated against, because we know that when pregnant women are involved and engaged in clinical trials, we know that those therapies, those drugs, can be proven to be safe and effective for pregnant women. At the end of the day, right now, there really is a question that pregnant women have, which is if you are at risk, a high risk of contracting SARS-CoV-2, if you are a woman, a pregnant woman with many comorbidities, increasing the risk of severe illness, and of course, we know pregnant women are already at higher risk of severe illness if they do contract COVID, then it really is recommended to receive the vaccine. At the end of the day, though, it is always the woman's choice, and it should always be the woman's choice, consulting with her healthcare practitioner about whether or not to get the vaccine, and that's what we recommend at March of Dimes.
Thousands of pregnant women have already received the vaccine, as you say, not during the clinical trials, but now that it's approved, whether they're in those first groups, if they're frontline workers. What do we know so far? Does there appear to be any sort of adverse effect?
Yeah, there really is some fairly good news. Maybe not the most definitive news that we all would like to see, but some pretty good news. Dr. Fauci talked about even last week about 10,000 pregnant women have already received their COVID-19 vaccine, and there have been no quote unquote red flags, which means that there's been nothing to come forward so far to suggest that the vaccine is dangerous for pregnant women. That's a good sign. The other thing we know is we know the science. We know that the mRNA vaccines, the Pfizer vaccine, the Moderna vaccine, present little risk to a pregnant woman. The vaccine is not an injection of live virus. It is not a kind of virus that would influence or alter the DNA, therefore presenting little risk to the pregnant mother or to her yet to be born baby. So there are a lot of good reasons and a lot of encouraging signs, I would say, for pregnant women who are considering the vaccine. One of the things that we're encouraged by is in New York City, for example, starting February 15th, pregnant women will be eligible to receive a vaccine. That's a good sign. So what we are saying at the March of Dimes is consult your healthcare practitioner, but by all means, know that as a pregnant woman, you are at potentially higher risk of severe illness if you contract COVID-19. So we would certainly recommend that women give serious thought to receiving the vaccine when they're able to.
And what about for women who are breastfeeding? Is there any sort of guidance for them?
It's the same thing. There really is no evidence to show that the COVID-19 vaccine is dangerous to either pregnant women or lactating or breastfeeding women. There's nothing to show right now that there's anything unsafe about it being passed, anything dangerous being passed to the baby while breastfeeding. So again, we know based on the science of the vaccine itself that there's nothing there that should suggest that there is anything dangerous that should pose a risk to a pregnant woman, to her baby. Again, this is always a decision that a woman should have the right to make on her own. And it also should be very thoughtfully considered, especially if a woman has other comorbidities. I just want to say that again, if a woman is at high risk, is an essential worker, is at high risk of being in contact with someone that has COVID-19, is at high risk herself of severe illness because of comorbidities, please consider the vaccine because it could save your life. It could save the life of your baby as well.
Is there any evidence that shows that getting the vaccine would potentially protect the baby once the baby's born, or is that not how it works?
Yeah, I don't think that there's any evidence of that yet. But this is the one thing at the March Times that we are also very strongly advocating for. One of the reasons why these decisions are so confusing, again, is because pregnant women have not ever been included in these kinds of trials. And this is really one of the things that we think we need to reverse. It's 2021. We need to take a more modern approach to how we advance science, especially as it relates to pregnant women, to newborn babies. At the March Times, we've been a long advocate for newborn screening, for all the things that would help us to make sure that moms and babies are protected. So, what we know right now is we don't have all of the hard science that we all would like to receive, but we don't have any evidence again that the vaccine is unsafe for a woman or a baby. We don't have enough evidence to know whether or not it would protect a baby if the mom gets it. But those are some of the things that we have to continue to pursue in science so that we have some of the real answers that all of us are really looking for at the end of the day.
All right, Stacey Stewart. Stacey, I feel like we both had violet, light-colored, purple
It's
turtlenecks on the brain this morning. So
it's
I like where your
turtleneck
head's
day
at with
today,
that.
Monday morning. Me too. You look
Stacey
great.
Stewart, the CEO of March of Dimes. So great to have you on, and such important information for women who are pregnant right now.